Hi, good afternoon. My name is Terika Thomas Mills, and today I'll be performing my ophthalmic medication administration video. I'm going to start by verifying my physician's order. I'm going to ensure that I have the correct patient, the correct drug, the correct dose, the correct time, the correct route, and correct documentation. I am going to open my patient's EHR. I'm gonna verify my medication order. Then I am going to take the medication and verify it against the order. Today the doctor has ordered Timolol 0.25% solution, 1 drop per eye, twice per day. So I'm gonna enter my patient's room. I'm gonna close the door behind me for privacy, and I'm gonna perform hand hygiene. Knock, knock, knock. Perform hand hygiene. Good afternoon, sir. My name is Terry, and today I'm gonna be your nurse. Can you confirm your name and date of birth? Okay, so Mr. Mills has correctly identified himself using 2 identifiers, his name and date of birth. Okay, Mr. Mills, so before we start, do you have any allergies to any medication, any food, any environmental allergies? No? Okay, good. So today your doctor has ordered some Timolol eye drop. And what this is, it is a beta blocker that we use to treat and manage open angular glaucoma or ocular hypertension, which is basically just an increase in the pressure in your eyeball, and this medication will help to decrease that pressure. Okay, so some of the side effects of this medication is dryness, itchiness, or watering of the eye. Other more concerning symptoms would be like dizziness, lightheadedness, or if you might notice there's a slow heart rate. But should in case this happen, just let me know right away, okay? And some patients have also complained of a little bit of burning or stinging when this medication is applied, okay? Another thing is that you might experience some blurred vision or sensitivity to light after this medication is given, but you should avoid driving or operating heavy machinery if you experience any of these symptoms until these symptoms has been resolved. Okay, do you have any questions, Mr. Mills? No? Okay, so I'm gonna go ahead. I'm gonna perform hand hygiene, and I'm gonna apply my clean gloves. So Mr. Mills, I'm gonna go ahead and I'm gonna put you in a comfortable position. You could either lay back, or I could recline the chair and you hold your head back a little bit, but I want you to look up for me, okay? I'm also gonna put your bed I'm gonna raise your bed to a proper working height, and I'm gonna lower the rails, okay? I am gonna start by cleaning your eyes. I'm gonna clean just in case there's any discharge or crust around the eyes. I'm gonna clean from the inner canthus to the outer canthus, okay? And I'm gonna use a clean washcloth, okay? And then I'm gonna do the same thing to the other eye. I'm gonna clean from the inner canthus and to the lower canthus, okay? And if necessary, if there's any stubborn crust or anything, I could use a wet washcloth and soak the area a little bit, and you know, just in case there's any crust that's hard to remove, just to make sure though you're not scrubbing on your eyelids. Okay, I'm gonna discard this, so I'm gonna discard my gloves also. I'm gonna perform hand hygiene, and again I'm gonna apply clean gloves. Okay, Mr. Mo, so I'm gonna take a clean tissue and I'm gonna place it right under your lower eyelid. And when I do this, you might feel a little pressure on your cheekbone. I'm gonna pull down so I can expose your conjunctival sac, and I'm gonna, when I administer this medication, I want you to look up for me, okay? So I'm gonna hold the medication 1 to 3, my dropper 1 to 2 centimeters from the conjunctival sac, and I'm gonna instill that 1 drop that was ordered. Okay. Okay, so since this can have systematic effect, I am going to put a little pressure on that nasolacrimal duct with my tissue for 30 to 60 seconds per eye, just to make sure, making sure not to put any pressure on the eyeball, okay? All right, and if you blink, or if the medication falls outside of the eye, then I'm gonna have to redo it, okay? I'm gonna have to redo the drop. All right, so I'm gonna discard this. All right, Mr. Mills, I'm gonna take another clean tissue, and then I'm gonna do the same thing to the other eye, okay? So I'm gonna take my clean tissue, and I'm gonna hold it right under your lower lid, 1 to 2 centimeters from the conjunctival sac. And again, you're gonna feel a little pressure on your cheekbone. And again, I'm gonna take my dropper and I'm gonna hold it 1 to 2 centimeters above the conjunctival sac, and I'm gonna apply 1 drop as ordered by the prescriber. All right, then I'm gonna put a little pressure on the nasolacrimal duct to reduce the likelihood of a systematic effect. 30 to 60 seconds, and you can close your eyes briefly and gently, okay? All right, so now I'm gonna discard my tissue. I'm gonna discard my gloves. I'm gonna perform hand hygiene. Okay, Mr. Mills, so do you have, are you feeling okay? Okay, so now I'm gonna lower your bed, and I'm gonna raise your side rails up, and I'm gonna ensure that the call light is within reach, just in case you need any help, okay? Do you have any questions for me before you go? All right, so I am gonna check back on you in a few minutes. I'm gonna go do my documentation, and then I check back to see if you're doing okay.